All right. Let me fast forward again now. Over the course of time, you developed some lumps and bumps in the pancreas. And you had part of the pancreas removed, and we follow things up after this difficult operation, but you recovered nicely.
Absolutely. Was back to work in 6 weeks.
And your bowel habits were different, and you felt good, and I remember you felt well, and you were pleased with that, although we struggled in the operating room and in the hospital, and I felt bad about that, but you've taught me a lot, as well as the trainees. We've scaled forward with the father dying of pancreas cancer, with the mother having insulinomas, and you having the head of the gland, pancreas tissue still left, and we stew about, could you develop some problems? At some point, you come to a decision with some discussion with a lot of different people.
And you with a lot of people, too.
Right. That maybe it's time to get rid of the entire pancreas and the duodenum. Was that a difficult decision for you?
I wouldn't say it was difficult. It was disappointing. And I'm sure it was for you too, because we had researched it so much doing what I call the half Whipple. And, you know, I felt great. It was just such a surprise to have, I think there were 9 tumors in the rest of the pancreas. And I did have diarrhea problems, but through diet and exercise, I didn't have to take any glucose products, any insulin, got off the pills for sugar, had lost some weight, and it wasn't difficult for me. It was disappointing.
And maybe that's a function of making sure surgeon and nurses and everyone talking to you with MEM.
Absolutely.
It's multiple tumors. We know we never sort of eradicate it unless the entire gland is gone.
Right.
And at some point in time, we take out your duodenum and your pancreas, and you are left with no pancreas.
Right.
And for the time that we have remaining, I'd like you to touch a little bit on what it's like to live without a pancreas, and that involves insulin business, involves blood check. With no pancreas, you have no exocrine function, no enzymes to break down your food. Right. So what is it like to live in the United States without a pancreas?
Well, I have this motto, and I say to everybody that I make any kind of an appointment with, if it's a good day, I'll be there. If it's not, I'm going to be listening to my body, and I'll be at home. So that's kind of what I live by. I've thought about this a lot, you really have to deal with not having a pancreas on a day-to-day basis. Some days may be good, some days may be bad. It's just, no 2 days are going to be the same. I started on an insulin pump 3 months after I had the pancreas taken out. One point that I thought that people, if they're going to have their pancreases out, should have complete diabetes teaching way before they have the surgery. I was a little luckier because, you know, I was a nurse and knew a little more. That's just a pearl of wisdom. Yeah. I got on the pump, and it has helped. I don't give myself injections. I use the pump only, and it's been it'll be 2 years and 3 months, and I'm still learning how to regulate the pump as far as sick days and different things, and it's very difficult because you don't know. I take Viocase double strength with 16, and I take 4 tabs with every meal. And of course, after the surgery, my stomach's a lot smaller, so you have to take the pills not all at once, because that alone just would fill up your stomach. So I've learned through trial and error. I take one at the beginning of a meal, and I just put them on a plate next to my meal and take them throughout the meal.
So specifically, if in the morning, if you're going to have scrambled eggs and a piece of toast and juice,
yes.
And that's going to happen at 7 o'clock. When are you taking these pills?
I take them with meals.
With the meal?
You take them with the meals. I take one before I start the meal, one in the middle of the meal, one towards, maybe like almost the end, and then one at the end. Okay. Is what's worked best for me.
And so 4 pills for breakfast? Is it?
Yes, 4 pills for every meal.
Okay.
For snacks, it's 2 or 3. If I'm going to eat a smaller meal, I may just take a couple. It's just really been a matter of finding out how your body reacts to these things. But with the pills, you know, the pancreas makes over 15 different enzymes. With the pills, only 3 of the enzymes are being replaced. So you can have dumping syndrome, which is when I finish a meal and I'll get up and for me, the dumping syndrome starts with just terrible cramps in my stomach. And what has happened is that the food has passed through too fast and collected a lot of liquid. And I also get very sweaty, palpitations, and I'll usually have a large amount of watery diarrhea. At which case, if I've given myself my full bolus of insulin, I've got to start taking some glucose tablets pretty fast to make up for that. So with that, with the pump, you can give your insulin on different waves, dual waves. Give half of it right after the meal, and then half of it maybe an hour after the meal. And that way, if you do have a dumping syndrome, you can stop that bolus from going in, and that prevents hypoglycemia.
Have you had spells? Have you had hypoglycemic
Absolutely,
spells?
absolutely.
Once a week? Once a month?
Oh, I probably have an incident still of once a week because my digestive system is so unpredictable. But I've had incidences where I have gone into dropped down into, say, the 40s without being warned, and actually have gone into seizures. That's happened to me 4 times in the past year. In which case, my husband, I carry a glucagon pen with me everywhere, and anybody that's with me, I've showed it to them and how to use it. And because I may not have symptoms, even though I set I have a glucose monitor, the continuous monitoring, but it doesn't always give you an accurate glucose reading. And even though I have the monitoring, you can't really give yourself any insulin according to what the monitor is giving you into your pump. It'll say, oh, you're 100. Well, I would never do anything without taking a finger stick because I have learned it's not 100% accurate. It can be 10 to 15% off either way, and that's a lot when you're talking about a hypoglycemic incident.
And so hubby takes the pen and jabs it in your side when you're having a seizure?
Yes.
And same sort of thing. Do you know the seizure's coming, and when he treats you or somebody treats you, you come back and know what's going on or realize what's happening?
You know, it's really funny, you know, again, thinking nurse-wise, I still hear, I know I'm having a seizure, and I can still, you know, hear some conversation. So, you know, your patients can hear what you're saying. You better be careful what you're saying when, you know, patients are in seizures and different things, because it's like you flash back and forth. And I, at times, have known when I'm in trouble. I get like a drunk feeling, and my speech